Good afternoon, everyone. Welcome to the Diabetes Sisters Life Class webinar, Appeals and Denials, supported by Merck through an independent grant. My name is Anna Norton, and I'm the CEO of Diabetes Sisters. I will also be moderating today's webinar. Today, I'm excited to introduce Melissa Lee and Cherise Shockley. Melissa was diagnosed with type 1 diabetes at the age of 10 in 1990. She is known for her diabetes technology writing as the tech editor for the online magazine A Sweet Life and her own blog, Sweetly Voiced, for her singing as the creator of the diabetes-themed music video parody series, D Parodies, and also for her voice as an outspoken patient advocate. Throughout 2015, she led Diabetes Hands Foundation as its interim executive director after having served on their board of directors for over 2 years. In 2016, she joined her husband Kevin, who is a software engineer and pioneered work in diabetes remote monitoring via a project known as Night Scout at the biotech startup Bigfoot Medical. There, with their team, they work to bring an artificial pancreas to market in the Silicon Valley, and she serves as their director of community relations. Cherise was diagnosed with latent autoimmune diabetes in adults, LADA, in June 2004. She is a well-known speaker and presenter on the topic of social media and founded and created Diabetes Social Media Advocacy, DSMA, and conducts live Twitter chats every week. You can search for these chats with hashtag DSMA. Today, Melissa and Cherise will be sharing their personal stories and strategies in navigating the complicated world of insurance as it relates to living with diabetes. They will also be answering questions you submitted. And if you have any additional questions, please use the screen to pose them. We will present questions throughout the webinar. Please welcome Melissa and Cherise to lead us in the next half hour.
Hi, everybody. Thanks for joining us today. This is Melissa's voice.
Hi, and this is Cherise.
So a lot of you guys probably come to this webinar. Most of us in our patient journey have experienced a denial of something that we've petitioned our insurance carrier for. Maybe it's a specific therapy, maybe it's a doctor visit, maybe it's a certain benefit. And so what we're going to talk about today is how to navigate that process, and we come at it from a couple different angles. The first thing that we want to talk about is how much responsibility, unfortunately, you have to actually take in this process if you want to be successful. So this slide, we say it's on you. Taking your blood glucose logs and making sure that you're logging blood glucose, device downloads, logbooks. It's on you to know what your insurance wants to see in order to approve the therapy you're pursuing coverage for. So if you, and we have some strategies that we're going to talk about how to figure that out. Cherise?
Yes, and also just to let you know that those blood sugar logs, they do not have to be downloaded. You can actually handwrite those. And as Melissa said, we'll go deeper into what's actually required. But this is one of the most important slides that you can see. It is your responsibility. Just because we pay for insurance, we think that, hey, they should give us what we need. Yes, they should, but if we're not giving them the information that they need to make an informed decision, it's going to get denied.
Yeah, I've also heard a lot of, and I honestly, I feel the same way. A lot of people in the community have posted things like, but it's none of their business. I don't want them checking in on me. This is Big Brother. Unfortunately, this is a responsibility we can't shirk. We actually have to provide these logs in order to get the therapies covered. And so that's sort of the first hurdle as we see it, is being responsible for getting the information to them so that you have a shot at getting this benefit. So the first thing we want to talk about then is you have to actually know what your insurer's medical policy, and this is a specific term, medical policy, is for the coverage. So if there's a specific thing you're looking for, you need to know what your carrier, whether that's Aetna, Cigna, the health exchange, what your carrier's medical policy is for covering that thing, whether that thing is a certain number of test strips per day, a continuous glucose monitor, a type of insulin. You have to know what their medical policy is. So you actually, unfortunately, there's not a user-friendly way to do this. You actually have to Google medical policy. So when I go looking for something, and I'm currently on a Blue Shield plan, I actually go in and I don't go to my insurer's website. I don't go to Blue Shield California. I go to Google and I say, Blue Shield California medical policy, continuous glucose monitoring, or whatever the thing is that I'm looking for information on.
And Melissa, if you don't mind me asking, why do you do it that way? Do you think you can, it's easier to navigate the system versus going to the insurance carrier's website?
Absolutely. So your insurance platform is sort of cross-functional in the sense that this is the same website that healthcare providers go to find benefits. The same. They don't really have a user-friendly way for the patient to navigate the site, and so you could find yourself down a rabbit hole of trying to find these things when the medical policy is actually written in language and terminology that is written for a healthcare provider. And sometimes you can get through a site pretending to be a healthcare provider only so far, but when you Google it, it actually takes you to the direct link for the document. Sometimes it's a PDF, sometimes it's just a web page. But so Cherise, you can talk a little bit about that, and I'm going to show some examples of some medical policies here. So.
Okay, so the first thing that you want to pay attention to when you are looking at, for instance, if you're searching for an insulin pump, this is actually a good example. It's where it says, Aetna considers external insulin infusion pumps medically necessary, and you have to meet something in one of these, in section A or B. You have to meet those criteria. You want to make sure that when you go to the doctor's office and it's time for you to get a new insulin pump, you want to make sure for at least 3 months you are at least checking your blood sugar for 4 times a day, so that way that's documented. If you have any lows or if you have any highs, it is totally okay to be upfront and honest with your doctor, so that way it's documented in your chart. So when you do need to get a new insulin pump or CGM, or if you need extra test strips, it's listed in your medical notes, so that way when the doctor's office is requesting a prior authorization for you to get extra test strips or for you to get a continuous glucose monitor when you go to Dexcom or Medtronic or an insulin pump, that information is listed in that documentation. And this is the easiest way to actually find out what's needed. So before you go try to get that information or get that approval, always, always, always look at the medical policy, because if you give them exactly what they're asking for, you should get approved.
Yeah, you should think of this as knowing the law. So if you're calling and saying, hey, I'm following the law, you actually have to know what the law is. If you're trying to, if you're trying to talk to your employer about the attendance policy and you don't actually know what the attendance policy is for your job, that's a problem. So this is how you find out the information that you would need. And I've actually used a medical policy when I've called a company to say, they'll say, well, if you look at our medical policy, and I'll say, I have it in front of me and I meet all 4 criteria. Now, hand over the authorization I need. So you can actually get pretty far with this. And Cherise's comment is a great lead-in to talking about how your healthcare team is actually part of this process. Many of us are, especially I think with people with diabetes, we're so used to self-management that we don't think about how we can engage our healthcare team in helping us through appeals and denials. So one of the things to their benefit is your insurer actually has a dedicated phone line for the doctors, and this is a completely different staff and sometimes even a different caliber of training that the person on the other end of the phone line receives. And this phone line is to deal with appeals and denials. It's different than a customer call center. So that's one thing. Then and this is super important, your provider can request something called a peer-to-peer, and that's where your doctor calls a doctor employed by the insurance company who has denied your claim. and then they can make a case to this doctor. Now, sometimes it's your endocrinologist or your primary care provider, and they're calling someone, and this person could be a cardiologist for the insurance company, but they're the one who denied your claim. So in a peer-to-peer, the doctor can make the case, which goes back to the doctor having good records.
Right, and then to add on top of that is that for most peer-to-peers, once the plan or the oh gosh, my blood sugar's low, I'm sorry. Once the reviewer denies the claim or denies the request for an insulin pump or strips or whatever, you have up to 24 to 48 hours, maybe 72 hours for your physician or a representative from that office, doctor's office, to call to complete that peer-to-peer review. If you do not complete that peer-to-peer review within that 24 to 48 and maybe 72 hours, then that's when you have to start the appeals process. And typically when your peer-to-peer is approved, it'll automatically get loaded in a system, and within 24 hours you can get whatever you need. So you may want to think about that, because sometimes doctors' offices will sit on them and you can't, because once it goes to that appeal process, it can be a very lengthy process, because they can take the entire 30 to 45 days to actually approve or uphold that denial.
That's a great point. And another great point that I've heard some providers say is that so providers have to go through this all the time. I've heard doctors and CDEs say that they spend hours and hours of time a week dealing with this process. So this is not what your provider was trained to do, but unfortunately they know how to do it because they've had to do it all the time. And one of the things to respect is that this is time for which your healthcare team is usually uncompensated. So if there's some sort of, I know some offices have a fee that goes along with doing this process. Maybe they have a $25 fee for this paperwork, or there's a reason they spend hours and hours of their week when they could be treating patients dealing with this. But engage them, they know how to get to yes. So, and this brings up what Cherise can really talk about here is the provider's notes about your care, including all your visit notes.
So it's very important, like I said early on, if you have a low, if anybody had to assist you in that low, if you had to go to the hospital, if your blood sugar stays high for a certain period of time, all of these things matter. I know sometimes we think that the doctor's office may judge us and put us in that quote-unquote word I hate, non-compliant zone, but it's not. It's to help you get what you need from the insurance company. So every visit, make sure you talk about your concerns, talk about what's working, what's not working, why you had to go from testing 6 times a day to 10 times a day, so that way that information's listed. Another thing you want to make sure you do is if you have to make adjustments to your insulin pump or to your MDIs, or if you had to make adjustments to your oral medication, make sure that information is listed, because sometimes with insurance companies, they want to see that you do know how to self-adjust, because sometimes that's one of the concerns is, okay, can this person make adjustments to their therapy without the doctor? So that's something that's very, 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 very important. If you went from working, the day shift to the night shift, if you notice that, if you have thyroid problems and you notice you forget to take your Synthroid and you have to, test more frequently, that information needs to be listed in the doctor's notes. It will help you, trust me.
Absolutely. All right. So now we want to move past the provider. Like, you can get really far into this process and probably have success using just your provider. But let's say that that's ineffective for you, or you want to have more troops on the ground. Essentially, you have advocates on the inside at your insurance company, your employer's HR department, and the therapy company that you're trying to get covered. So if you're trying to get a CGM, you can reach out to the CGM company, or an insulin pump, you can reach out to people who are benefits specialists in those companies. So you have all of these different types of advocates, and we're going to talk about those. So the first is that you can ask your employer or your spouse's employer's HR or plan administrator to intervene on your behalf. Cherise, do you want to talk a little bit about that?
Yes. Sometimes with insurance companies, right, you think, hey, I'm going to give this, I'm going to ask for this, and they tell me no, then that's it. However, the good thing is with HR, your HR team, they actually have the capability of helping you get something overturned. So if you have all the documentation that you need, you can actually get what you need on behalf or through your HR department, because your HR department, they are the ones that actually work with the insurance companies to get your insurance. So if there's any issues, try your HR plan. Also, if you have issues, like say for instance you've been waiting for something to get approved by your insurance company and you've been waiting for 14 days and it's just too long and you haven't heard anything back, those patient advocates inside of the insurance company, they will check on it for you to find out what's happening. If you never called a patient advocate, they're pretty awesome to work with. They can get things done and approved a lot sooner. So I'm not sure if anyone knows this, but with insurance companies, typically if you have a commercial plan, they have to give you an answer within 30 days. If you have a Medicare replacement plan or an Advantage plan, you have to have a response by the insurance company within 14 days. If you do not, the insurance company can get fined for that. So you have to use those patient advocates to get stuff moving sometimes, and they can actually find out where things are. If it's, has potential to get denied, they can tell you everything that you need to know to help you get to the yes.
And this example right here is one that I just found when I was looking for info on health advocates. This is a BCBS Michigan description of who can use a health advocate and what they do. So on your insurance company's website, you can probably find information about their health advocates. These are not typically something that's offered to you. You're never arguing with a phone rep and they're like, I think you need a health advocate to deal with. Like, they're not going to offer this up to you, so you need to know what your rights are to request them. So I just have an example right there. And then finally, like I said, you can call the company that makes the therapy you're seeking coverage for. So whether it's Dexcom or Medtronic or LifeScan, whoever it is that you're needing help for, they have benefit specialists on the inside who know different ways that coverage can be approached. Like maybe they can check, and instead of your durable medical equipment benefit, maybe they can check to see if their product or therapy can go through your pharmacy benefit on your insurance, and maybe they can check to see if there's a different distributor in your network for this item. So I always recommend calling the companies and saying, hey, I've been denied for this and I need to know what you suggest is the next step. So there's all kinds of advocates beyond just your healthcare team that can help you fight this battle.
Yes, and I was going to say, on top of that, if you received a denial for a therapy from one company and you decide to go to another company, make sure you keep a copy of that denial letter, so when you do go to that company, to a new company, you can tell them exactly why it was denied, so that way they know what they're up against when they try to get their therapy approved for you.
Absolutely. And again, they've seen this before too, and it's in the company's best interest from a marketing sales perspective that they want to get you on this therapy, so they're going to try. All right, so that brings us to when you're actually on the phone to your insurer, and we have a couple of strategies to offer, and I think both of us have tried these, and one is, and I seriously used to do this, I had a dedicated notebook, and in the notebook I wrote down what day I called, who I talked to, what they told me, and when they told me they were going to get back to me, and then when I called them later and they'd never heard of any of this, I could quote it back to them and say, I'm still waiting on my XYZ, or I was told I'd be called. So having a notebook and having everything in front of you, having the denials letters, having the medical policy maybe printed out, and have all of this in a notebook where you're not scrambling for anything. And they say, well, what is your blah, 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 or what's your date of diagnosis? Having everything in front of you is a great strategy to keep you calm and feel like you have the upper hand in these discussions, because otherwise you can feel like you're just going to have to go through this process again because you didn't have the information that they were asking you for.
Yes, and then also to add to that, make sure you receive a reference number. Every insurance company, they keep reference numbers for them to be able to go back and physically pull the phone call if they had to re-listen to the call. So whether it's the date and the person's name that you speak to, or or a different reference number, get the reference number. That is your best friend.
Absolutely, and expecting that you'll just remember it from one period to the next. It took me nearly 9 months to get a $200 refund that I wasn't supposed to be charged once, but I called almost on a weekly basis with follow-up and requested a health advocate. I got what I needed partly because I was persistent and organized. So the next thing, if you feel like, I love this graphic. If you feel like you've hit a brick wall with the representative you're on the phone with, we have a really good tactic, and it is, what is it, Cherise?
Smile. Because if the person on the other end of the phone can tell that you're frustrated and angry, you're not going to get anywhere. So you always have to put on a happy face, even when you really don't want to.
And then my favorite strategy is to call back and try to get a friendlier rep. So there's, yes, they may flag your file for all you know, but calling back and starting over again can help you de-escalate your frustration and make your case again. And also sometimes a different rep is going to give you a different response or a different level of empathy even. So that's another approach. And then finally, when things get rough, we also recommend taking it to social media. I have some examples here of people we know in the community who took their beef to Twitter and actually tagged the company and went public with their concerns and got responses. So, companies care about their public perceptions, and taking it to social media is sometimes a necessary evil to get a little bit of movement.
And then on top of that, if you take it to social media and someone else from the community, they see it, it gets retweeted over and over again until you get an answer.
Yeah, there was a situation, I want to say it was last year, where there was a child that was denied coverage for CGM, and the community, it basically went viral throughout the community, and the child eventually was granted the coverage they needed, in part because of the community outcry. So remember that there's power in publicity. So we are we're ready for sort of final thoughts and some answering any questions that I know have come in. Cherise, do you have anything you wanna add before we get to the questions?
The only thing, like I stated when we were in Chicago, is that there are certain, when you look at the medical policy criteria, and when you go in and look at the terms where they say, your insurance will only pay for this every 4 years, or your insurance will only pay for this every year, because when you do that, you can't switch from one insulin pump to another insulin pump because you like one better after you realize, you have where you just bought one a year ago. The insurance company is not going to pay for another one, because you want a new one. The insurance companies typically pay for a new pump every 3 to 4 years. If you have Medicare, it's every 5 years. And when it's time for you to get a new pump and your pump is out of warranty or your CGM is out of warranty, you want to make sure that you have an issue with the product. So for instance, if I need a new insulin pump and there's nothing wrong with my pump, and when I call the medical device company and say, hey, my pump's out of warranty, and if they ask me, for instance, is anything wrong with your pump, and you say no, they have to document that and they send that to the insurance company. And when it comes back, it's denied because there's nothing physically wrong with your pump. So just because it's not out of warranty, just because it's out of warranty doesn't mean insurance companies are going to pay for it anymore. Make sure there's something wrong with the pump when you try to get a new one. Same thing when you go for a CGM or continuous glucose monitor. If you haven't experienced any extreme lows and it hasn't been reported to the doctor's office, you're not going to get a new one. Make sure you keep logs. Make sure you document. Make sure you write it down. Sometimes people think and assume that their doctor's office keeps their glucose, their blood sugar logs in their chart notes. Most doctor's offices do not. They use it for that visit only, and then they shred them. Make sure you keep a backup just in case you need them, especially if you have Medicare. Medicare requires at least 60 days of blood sugar logs. So when you go, for instance, another good thing for Medicare and overutilization when it comes to test strips, make sure if you need 6 days, if you need to check your blood sugar 8 to 10 times a day, make sure you're logging every time. So that way when it's time for you to get a renewal on those test strips, when your doctor has to get a PA or when you go to the pharmacy to pick up strips, you have your logs showing that you are truly testing 8 to 10 times a day. And if you need to, write a letter. Writing a letter always helps for when you're trying to get approval through your insurance company for devices, or if you're trying to get something from your pharmacy benefit manager, because no one knows your story better than you. Always write a letter when in doubt, and then work with the doctor and document.
And it can also be really frustrating to be asked to prove over and over again that you still have diabetes. Unfortunately, this is sort of baked into the system, and it's possible that your insurer could ask you to do tests that don't make any logical sense to you as a person with diabetes. Perhaps they want you to do additional C-peptide testing to see if you still need insulin, or maybe they want you to prove that you're still having low blood sugars on a CGM to prove that you still need a CGM, because it's possible that they could say, oh, your CGM is preventing low blood sugars, you clearly don't have low blood sugars, you no longer need a CGM. And you say, okay, you guys are idiots. But it's important, though, like we said, it's on you. The responsibility is on you. So if you have to undergo these tests, or if you have to prove that you still have low blood sugars, even on your therapy, then take the necessary means to actually prove those things to the company. And be prepared in advance. If you know your warranty on something is coming up and you're thinking about, let's say your pump warranty, your CGM warranty is coming up in a couple of months, get lead time on that. Start taking your blood glucose logs now. Start collecting that information now. It'll make the process go much more smoothly so that you don't get to the last day of the warranty of your insulin pump and find out that they're not going to cover a new one for you.
Yes, and also I was going to say something about your testing frequency. Those change often, and sometimes, like I said before, is that we can't prove one meter is better than the next. However, if you notice a trend when you're checking your blood sugar with 1 meter and you're noticing a trend with the other, and you take those and you compare that with your A1C, give that information to your doctor, because it's very important. And if you are in the process of wanting to try a new therapy or a new medication, make sure it's listed in the chart notes, so when you're having a conversation with your doctor can document that. So if you go for something, say if you wanted to test 6 times a day because you notice that your blood sugar is high around a certain period of time every day, make sure your doctor documents that in the system or in their notes, so that way when you go and he goes to try to get approval for 6 times a day, then that information is documented. Same thing with if you're on MDIs and you want to go to an insulin pump. Make sure you have that discussion with your doctor because they're going to want it. Same thing about proving that you have diabetes. You might have to prove that you've had diabetes education, so you may have to make a quick appointment to go see a CDE so that way, or a doctor, so that way you can have that information documented, because they're going to start asking for stuff and it's not going to get any easier for us. So we have to help us help ourselves.
Well, thank you, Melissa and Cherise. We actually had a couple of questions that came in during the webinar, and some that came in prior to the webinar that were about test strips. I think you've answered them in this conversation right now, the last few minutes. So I'm going to move on because we have a few other questions. One of them is from a diabetes sister who says, as a Medicare patient, I would like to ask whether you have any hints about appealing Medicare's denial of CGM coverage. Specifically, what does it take to get an exception? I have used the Dexcom CGM for 6 years now with great results and fewer highs and lows. Before age 65, my insurance plan covered it, no problem. But when I became Medicare eligible, I've had to start paying the full amount myself. Do you have any hints?
What I would like to say is Medicare is exceptionally tricky. And part of the reason for that is that since it is a government program, there actually doesn't exist a benefit category for continuous glucose monitoring. And to get a new benefit category into Medicare actually requires an act of Congress. So on the advocacy front, it's super important that we're all knowledgeable and supportive about the CGM access bills that get reintroduced every year in Congress and have yet to, they keep adding co-sponsors and we're making a lot of progress, but we've yet to pass that bill that would create a benefit category for CGM in Medicare. Now, that being said, anecdotally, we do hear of people who manage to get an exception on this. It is few and far between, and I've only heard of one or two. But what I know worked for those people, they wrote to their legislators. They wrote. That letter writing, they wrote regularly. And they made cases for continuity of care, continuity of therapy from what they were on to what they're to be able to stay on the therapy that was working for them before. This is an uphill battle and one you are likely to lose. It's important that you fight it, though. Cherise, do you have things to add on that?
I was going to say, what I can do is whoever asks that question, if you can give me that information, Anna, because I can send them links to Laddie's blog post, and it talks about different ways you can appeal Medicare and what that process can look like. And I believe there's actually a couple of successful people out there, like Melissa said, it took them a long time. They had to get lawyers involved. They had to go to a judge. The process is very long. It's doable, but you have to be willing to fight to make it happen. And your doctor's office your physician has to be on board for it as well.
Okay, and I will forward you that information. I have it. We have another question, and this person says, I've been covered by my insurance at 90% with no copay for pump supplies. However, I cannot afford the remaining 10%. Is there a waiver system or some kind of alternative you know of to address an issue like this?
Yes. So insurance companies have the problem, I think, sometimes is that it's not that people do not want the pump, it's just the services that they receive. They have to have continued services with the pump supplies. So what I would recommend doing is letting the company know that you're having financial difficulties with that 10% and see if you can make payment arrangements. So say, for instance, if you get a 3-month supply of infusion sets and cartridges, would it be possible for you to break up that cost over the three-month period, so then when you reorder, you can reorder without worrying about your bill stacking up? A lot of distributors and also pump companies will work with you. You just have to, like I said, be upfront and honest and tell them, hey, look, I'm having issues right now. Is there any way we can make payments? I can make payment arrangements for these supplies.
Okay, thank you. And we have one last question. It is, do you have any recommendations for trying to get approval for a different brand of device, a pump, a CGM, a meter, than what your insurance plan says it will allow? Is there any hope of getting this accomplished?
A few things can affect that, especially if it's for pediatric use. The bar is a little bit easier to cross. So if you, and this is where we get into the tricky area of formularies. So on an insurance, we used to have a system where there were different tiers, and there would be like the preferred tier, and if you wanted to pay a little bit extra, you could get like the tier 3, which might be the non-preferred item. We've moved into, in the last 4 years, into a situation where instead of having tiers, they have what's on the formulary or you get nothing. That's a much more challenging environment to try to navigate. It is possible, that being said, it is possible to argue for an exception. So some things are, if your insurer covers only brand X meter and strips, but your pump therapy system actually uses an integrated brand Y meter and strips, then you can have a coverage exception for that. Your doctor needs to be involved in that. If you use insulin A and they want you to switch to insulin B at the new year, you can actually show them logs of 90 days of insulin B and say, see, this doesn't work for me as well as when I was on insulin A, but you may actually have to try the covered therapy before you can make the case for the exception to therapy. Cherise, I know you have things to add on this.
Yes, it's easier so first, it depends on your insurance company and who they have a contract with. So you can actually get it approved. It's going to take a lot of hard work because you're going to have to basically pick the pumps apart and say, well, this one can do this for me and this one cannot do X, Y, Z for me. So when you go in, for instance, Kaiser is a Medtronic pump. They love Medtronic. So what you want to do is, if you have Kaiser, you can get it overturned, but you have to have a lot of medical documentation stating why you cannot use a Medtronic pump. You have to make sure if it's an Edimus pump or a Roche pump, you have to have documentation on why this pump will not work for you. It won't work for you not because you don't like their customer service. It has to affect your quality of life. And if that pump is going to not help you live well with diabetes, your insurance company is not going to pay the money for that device. But like I said, your doctor has to be on board, and you have to know going into the fight what they will and what they won't and why. Like, why did they choose this brand of pump for you? What's the medical reasons for it? Is it better for you? So you're going to have to, like I said, pick it apart. It's going to take a lot of time. It's going to take a lot of effort, but it is possible. You just have to fight for it.
Great.
Yeah, it is possible. And it's, like I said, you might have to be willing to try the thing they want, which is harder if you're talking about a durable piece of equipment like an insulin pump or a CGM. But where an insulin or a test strip is concerned, you might actually have to try the therapy before you can make your case for why the therapy doesn't work for you.
And yes, and also make sure if you are trying something that you know is not going to work for you, especially with devices, make sure you find out what the return policy is, because some plans or some DMEs or pump companies, you have 30 days. So you can't go 6 months out and say this isn't working for me and try to get a new one. You have to really figure out if this is going to work for you within that 30 days. Actually, before the 30 days, because I would say 20 days. So that gives you time to return it and fight for you to get a new one and document everything. This pump is making me, I can't do this, I can't do that. This is doing this, this is doing that. So that way you have documentation when you go in and say, I try XYZ, and this is why A is going to work for me because XYZ is not working for me, and here's my documentation to prove it.
If your provider has any historical evidence of, like, let's say it's been 6 years since you tried, one brand of insulin, and when they switched your brand of insulin to the one you prefer, your A1C went down. If you can get a hold of that historical data, that could help your case. Oh, well, when I was using your preferred brand, this was my experience. Not quite as strong as if you were to just go ahead and switch to it and try again, but you may be able to collect that evidence in advance.
Great. Well, thank you both. Thank you, Cherise. Thank you, Melissa. Before we sign off, I want to thank Merck, who supported today's webinar through an independent grant. I also want to thank each of you for registering and participating in the webinar. We had over 75 people register, and as promised, we've taken all the registrants and entered them into a drawing for a copy of Reva Greenberg's latest book, Diabetes Do's and How-To's. Today's winner is Joanne DiNapoli. Congratulations, Joanne. We'll be contacting you to send out your prize. If you would like to listen to this webinar again, please visit www.diabetessisters.org tomorrow morning, where we will have today's audio and presentation slides available. And please mark your calendars for our next webinar, Diabetes and Self-Confidence, led by Kimberly Goodson and scheduled for Wednesday, November 16th at 4 p.m. Eastern Standard Time. Thank you all very much for joining us and have a great afternoon.